So does Medicare cover acupuncture? Yes. Wait, what? That screen said it doesn't. So we've done a couple of videos about some of the benefits that Medicare does and doesn't cover, and some of those are really surprising. But one of the biggest surprises is actually acupuncture. And yes, Medicare is confusing, and despite what Medicare.gov says, Medicare actually does cover acupuncture. But there's a catch. As always, you need to know how, when, and why so that you can actually get it covered.
So this is where a lot of the confusion comes in. Under chiropractic services, and this is the screen I showed you just at the beginning of this video, you'll see Medicare doesn't cover other services or tests a chiropractor orders, including x-rays, massage therapy, and acupuncture. So when you're on this screen, it really does look like Medicare doesn't cover acupuncture, but that is not really true. If you see on this screen, which is really just under acupuncture, Medicare Part B covers up to 12 acupuncture treatments in 90 days, but it is only for chronic low back pain. Now, that's the easy part. The next part is really the tricky part. This is where it gets tricky. Note, not all providers can give acupuncture, and Medicare can't directly pay licensed acupuncturists for their services. Medicare also doesn't cover acupuncture, dry needling for any other condition, but that really isn't the tricky part. The tricky part is figuring out how to get a provider that operates within Medicare that can offer acupuncture. Now, if you are able to find such a person, then as I said, 12 acupuncture treatments in 90 days, Medicare covers an additional 8 sessions if you show improvement. However, if you aren't showing improvement, they won't cover your additional treatments and you'll pay 100% of the costs. So total, you can get a maximum of 20 acupuncture treatments in a 12-month period. But again, that's only if you show improvement. As far as that chronic low back pain, here's how Medicare defines chronic low back pain. Again, you must get acupuncture from a doctor or another healthcare provider like nurse practitioner or physician assistant, not an acupuncturist, not a chiropractor.
So ordinarily, Medicare.gov has a great feature that will enable you to find doctors and specialists who offer specific treatments and services. So you can just use that, right?
So here's the page, Find and Compare Providers Near You. I'm going to show you why this is a little bit tricky. We are going to put in a Charlotte zip code, and I am going to put in acupuncture. Look, here. A chiropractic and acupuncture services that operates within Medicare. Wait, this is chiropractic. That means, as we saw on that other page, they can't offer acupuncture services because it has to be a doctor or nurse practitioner or physician assistant. So that's really sort of the trick here is that if you type in acupuncture to find somebody that offers those type of services, if it's in their name, it's probably going to be chiropractic services that offers acupuncture or a licensed acupuncturist, which, as we just discussed, Medicare doesn't cover. So really, the best way to get this covered by Medicare is probably to go to your doctor and get a recommendation from them, from someone who is a doctor or physician's assistant or nurse practitioner who offers those services. Unfortunately, this page isn't going to be of much assistance in this instance.
A brief pause here to remind you to please like and subscribe to stay up to date. And of course, if you have questions, you can reach us at the number on the screen or in the comments below. We are licensed nationwide and there is absolutely no charge for our services. All right, back to it. Now, you may also be able to get acupuncture covered with a Medicare Advantage plan. Remember that Medicare Advantage plans are an alternative to original Medicare. However, they must offer at least the same benefits as original Medicare, which means with those same rules and stipulations, you could get acupuncture covered. However, many Medicare Advantage plans offer additional benefits to entice beneficiaries. Very often it would be things like dental, vision, hearing, and prescription drugs, but there are other benefits that can be offered as well, and acupuncture may be amongst them.
So here I am again on our favorite website, Medicare.gov. I'm going to put in a Florida zip code this time and look for Medicare Advantage plans. I'm just going to put I don't get any help from these programs really because I just want to look for acupuncture right now. Okay, I am going to go over here to where it says insurance carrier. And for right now, I'm going to filter for Humana just because I know offhand that Humana sometimes does offer acupuncture coverage. Okay, so it's not going to be over here, this little snapshot that we talked about in other videos. of plan benefits because it's not one of the most common benefits, what you're going to have to do is click on plan details. And then we're basically going to scroll all the way down. Keep scrolling, view more benefits and costs. Keep scrolling, keep scrolling. Past drug coverage, extra benefits. That's where we want to be. But again, keep scrolling, keep scrolling. Here's some of the more popular ones. Hearing, dental care, vision. View more extra benefits. Here we go. Acupuncture, some coverage. So we'd need more specifics, of course, if that was the plan that you were interested in. But you can see that if you're going to search for acupuncture, that's the way you have to do it. You have to scroll all the way down because view all filters. It's not one of the benefits that you can search for, unfortunately, so you sort of have to do it manually.
Now, if you want to learn more about some of the surprising benefits that Medicare does and doesn't cover, I'd highly encourage you to check out this video over here. You could also check out our All About Medicare playlist to learn more all about Medicare. Of course, if acupuncture is a benefit that's important to you, make sure you discuss that with your broker during your enrollment time. If you have any questions, you can reach us in the comments below or at the number on the screen. And as always, please make sure to like and subscribe. We'll see you next time.